Welcome, everyone, to another episode of Currently Speaking, the podcast of the Current Consulting Group. I'm Bill Current, founder of the Current Consulting Group, and I'm joined today by Brian Feeley, Vice President of the Current Consulting Group. Welcome, Brian.
Hey, Bill. Thank you. Appreciate that.
And today we're going to do another installment in our series on oral fluid testing. I hope you've seen the other episodes, but if not, check out our website. You can find them there. Today we're going to talk about product package inserts and what to look for and some things to be, on the lookout for that might be a red flag for you. So, Brian, let's start with the basics. What is a package insert?
Sure. So, a package insert, and I should probably preface this by saying, for the most part, we're probably talking about instant tests. Those are the rapid tests that might be used at a point of testing in someone's facility. Although laboratory-based tests also have a package insert, the typical, HR or safety or risk person isn't usually reviewing a package insert for a lab-based test. However, they can, and it's still useful to know sort of what's in them. So a package insert really is, think about it as sort of an instructional document that shows how to use the test, what the performance data looks like for that product, how it's been tested, and a number of other things that we'll talk about. But generally speaking, it's got sections, and we'll talk about those. But it should typically give you the intended use and how the product is constructed, what it does. In terms of its what it's testing for, and then again, as I said, the performance data that shows how it works and how what the performance of the test looks like, and then it has some other sections that you want to sort of look at, which may involve things like cross-reactivity for drug tests and things that the test might react with or cross-react with that you want to be aware of.
So, what's meant by intended use? I mean, what should the user or the buyer look for when it comes to intended use?
Right. So an intended use statement typically will include what the test is intended to test for. Like, let's say this, for example, test is intended for the use in testing cocaine, methamphetamine, THC, et cetera, et cetera. So it'll typically list the drugs that are being tested for. And it should typically say in human samples, whether that's a human urine sample or human oral fluid sample. And typically it will also include a very important statement, which is what the clearance has been or what approval level that product has achieved. And there's a couple of different ones that we can go through, but typically you've heard the term FDA cleared. There's a new term called the NI label, which we can talk about. And then there's other things like forensic use, which typically are not used in the workplace market. They're typically reserved for law enforcement, criminal justice, those sort of markets.
Okay, so you've mentioned a few different things, and it could probably get confusing for the average person. I know it would for me. So how do you work your way through sort of that technical information that's in a package insert?
Yeah, and I guess the thing to beware of for the listeners here is you probably have two different types of people that are listening to this podcast. One is the actual person that's performing the test, and that is, really should be very aware of what that package insert says, how that product performs, especially if they're using it for either their employees or they're using it for one of their customers, for example, a provider or a third-party administrator. They should really know what a package insert is, and dive into it as much as possible. For an HR professional or someone who's relying on a provider to provide them with a good test, they don't necessarily have to know the ins and outs. Although, my preference, even if I owned a company and I was having someone do testing for me, I would kind of want to know the basics about it. Have they looked at the insert? What does it say? So, you should rely on that provider that's running a test for you to really make sure that they've looked at it, they know what the intended use is, they feel good about the test and its performance characteristics, and so that would be my suggestion.
So a couple of terms you've mentioned earlier: specificity, sensitivity, FDA clearance, things of that nature.
Yep.
If those things are not on the back of the package insert, should that be a concern to the user?
Yeah, so I think the things that are of concern when it comes to, you mentioned the term FDA cleared, and I did too. Traditionally, products that are used in workplace testing do have that FDA clearance, and it might be termed in vitro for in vitro diagnostic use on a package insert. It might be called one of the new terms is E&I, which is employment and insurance use. So that's a different sort of designation now that we'll go through in another later podcast. But it can say for workplace testing, it can say E&I label, it can say in vitro diagnostic use, or usually they don't say FDA cleared. And but so be aware of that sort of thing. And if there is no extensive studies that are listed in that package insert that show the number of samples that might have been tested, and ideally you really want them to be, these should be clinical samples. They should not be what you might call fortified, or samples that someone used where they spiked drug into a buffer and recovered those and are reporting on that kind of data. So it really should have a good number of positives in the package insert that were assessed, negatives, and it should compare them to a reference method such as LC or GC mass spec, and give you and the accuracy and sensitivity and specificity should be within the range that you're typically looking for a diagnostic product. Meaning, accuracy, if you're comparing it to a mass spec method, you typically want 95 to 99 or 100% correlation with that reference method. If it only correlated 50%, that means 50% of the time it's going to be in agreement, and 50% it's not with a reference method. So that's not good. Sensitivity and specificity are terms that refer to the degree of false positives and false negatives that a test will give. And again, as a manufacturer, you're trying to develop a test that has the right balance between those, so you're not ending up with a lot of false positives that need to be ruled out at the lab, but also importantly that you don't have a lot of false negatives, because those are samples that will screen negative but will actually have drug in them and that will be positive. So there's a delicate balance there, and by reading the insert, you can get a pretty good idea of what the manufacturer, the developer of the test did, what studies they performed, and whether there's a good number of samples there to back up what they're saying.
So we know that some state drug testing laws will make reference to FDA clearance. They may require a device to be FDA cleared, and they may use the term FDA approved, but we're talking about FDA clearance in order to use it for workplace drug testing purposes. Is it possible that a package insert would not mention FDA clearance, but could still be a device that's been FDA cleared, or will it always be back there?
So really the term FDA cleared typically is not in the insert. It will say, if it's FDA cleared, you'll typically see a designation that says for in vitro diagnostic use, IVD. That is an indication that it has been submitted to the FDA and it's been reviewed. If it doesn't say that, if it doesn't say IVD, then you're typically going to see designations like employment and insurance use. More recently, a new term, as I mentioned, you're going to see for forensic use only. So you will see those terms, but the FDA really doesn't approve these sort of tests. They call it a 510K. So they look at your labeling, and they look at the product and your data, and basically make sure that what you're saying that test really does, that you have the data to back it up. And so it's not like they say, okay, you're approved by the FDA. It's not like a supplement or like a food or a pharmaceutical, for example, where they really do approve it. They just give you the okay to go ahead and market it under your labeling. And so you won't see FDA cleared typically, or FDA approved on a package insert for a drugs of abuse test.
So will the package insert tell the user where this device has been made or manufactured, and is that important?
Yeah, so a package insert typically, as you look at the backside of an insert, or the bottom toward the end, it will typically show the manufacturer and where it was made. And traditionally, A lot of the diagnostic companies today are manufacturing products outside of the U.S., but some of them are making them here, and so you'll see that designation "Made in the USA." You could say "Made in China." You could see "Made in China," "Made in Taiwan," or in other countries, and that's not necessarily a bad thing. I mean, it's in some cases manufacturers have to go outside the U.S. to be able to compete. Get a product at a reasonable cost for them to be able to compete in the markets that we're in. And so that's not necessarily a turn off unless you have your own specific bias toward, trying to purchase something made in the U.S. Again, if it's made outside the country or here, you're really still looking at those claims, the labeling, and the performance data. And obviously, the other thing that people should do when they're looking at a product is they should get references. They should talk to people who've used the test or tried it, and make sure that there's good reviews out there on it. And again, that's something that a provider should do. But if you're on your own and you're not using a provider, you're doing your own testing, you probably have to do a little more homework in that regard and make sure you're checking out some references and talk to people who are using the product ideally. And a manufacturer, someone that's selling you that test, should have no problem giving you some references and putting you in touch with some people that are using it. If they don't, that could be a flag.
So as part of that due diligence process, can the buyer get a copy of the package insert before they make a purchase decision?
Oh, sure. Absolutely. And, I always suggest to people when they're adopting a new product, it's a really good idea to do a pilot and to get a hold of some of the devices and to run it, and make sure that it's doing what you want that test to do in terms of its ease of use, the procedure of which to use the test, and that when you get those demo devices or you do those pilot studies, you're going to have an insert and you're going to be able to look at that pretty, just like you would if you were buying it on a regular basis. It should be the same product insert.
Okay. So in conclusion, if you had to sort of narrow it down to 2 or 3 key things to look for in a package insert, what would they be?
Well, it would be the intended use to make sure that it's got the approval level that you need in your setting. That the performance data is up to snuff. That you like what they did, and that they appear to have done their homework. And for drugs of abuse tests, there's a cutoff. So each drug has a cutoff level, whether it's for urine or oral fluid, or and those cutoff levels are important. So make sure that they're not all the same across all devices. They sometimes will vary depending upon the manufacturer and what they intended that device to be used for. And so make sure the cutoffs are where you want them to be, and that there's there wasn't anything that jumps out in terms of interference studies or things that you want to be careful about, which is sometimes more toward the back end of the insert. But essentially, if you can look at all those things, you're going to be in pretty good shape. But again, testing it out, doing a pilot, making sure that it's working properly as advertised is really important.
Excellent. Thank you, Brian. Anything to add?
No, that covers the insert for now, Bill.
Okay. Well, thank you, everybody, for joining us for another episode of Currently Speaking. If you'd like to get a hold of the Current Consulting Group, we've got the contact information right here in the podcast. You can email Brian directly or just email our company. Visit our website at currentconsultinggroup.com, and we'll be happy to answer any questions that you have. Thank you again for joining us, and that concludes today's episode of Currently Speaking.